This video will detail the process for giving intramuscular and subcutaneous injections. You may encounter intramuscular injections during the administration of immunizations, antibiotics, pain medications, or sedative agents. Examples of subcutaneous injections include immunizations like the MMR, medications, insulin and lidocaine, and placing a PPD test. Contraindications to these procedures include patient with bleeding disorders, inadequate peripheral circulation, cutaneous vascular malformations, or denuded or infected skin. It is important to have all of your materials available and ready before beginning. Necessary equipment may include isopropyl alcohol or chlorhexidine to clean the skin, a sterile syringe, a sterile needle. This can be a 20 to 25 gauge 1-inch needle for intramuscular injections and a 27 gauge half-inch needle for subcutaneous injections, the injectant, which is the vaccine or medicine, and a bandage and gauze. As with any procedure, practice good hand hygiene and utilize universal precautions. If giving an immunization, verify the lot number and enter it appropriately into the medical record. Next, draw the medication from the vial. You may do this with an 18 gauge blunt needle or the needle you will use for the injection. Here's a helpful tip for filling the syringe. After pulling back on the plunger to fill the syringe with air, insert the needle into the inverted vial. Depress the plunger to inject the air into the vial. Then, assure that the needle is within the fluid level and use the resulting negative pressure to pull medicine into the vial. Remove air from the syringe by pointing the needle upward and depressing the plunger until all of the air is gone. Cover the needle with a cap to avoid spraying the injectant across the room. Have another staff member or parent hold the child if necessary. Injection sites for intramuscular injections include the upper lateral arm, the anterolateral thigh, and the gluteal muscles. Subcutaneous injections may be given on the upper lateral arm, the anterolateral thigh, or the abdominal wall. When giving an IM injection, you need to assure that the needle reaches the muscle. The skin is generally punctured at a 90-degree angle. First, clean the skin. Then, prepare to insert the needle. In this example, the skin of the deltoid is pinched to expose more of the muscle. Insert the needle so that the hub of the syringe touches the skin surface. Then, slowly push the plunger to administer all of the injectant. Next, remove the needle and hold pressure with a cotton ball or gauze. And finally, place a bandage over the injection site. Subcutaneous injections are destined for the layers of skin beneath the epidermis and dermis. As opposed to the perpendicular entry of an IM injection, the skin is entered at an angle. First, thoroughly clean the skin. Then, using the non-dominant hand, pinch the skin of the injection site between the index finger and thumb. Puncture the skin at a 45-degree angle. This way, the shorter needle used in sub-Q injections will not reach the muscle. Depress the plunger of the syringe completely to inject the medication. After removing the needle, you may need to hold pressure with a cotton ball or gauze prior to placing a bandage. After the injection, observe for medication effects. If you have just given an immunization, discuss potential local and systemic reactions with the patient and their family. These are always found on the vaccine information sheets. The pain of injections is generally mild and can be treated with rest and analgesics.